Thank you for the opportunity to present the findings of our study entitled Unintended Consequences of Pandemic Management Strategies on Residents and Families in a BC Long-Term Care Home. That was led by nurse researchers in partnership with a long-term care home in Vancouver, British Columbia called Louis Breyer Home and Hospital, and funded by Michael Smith Health Research as well as BC Support Unit. My name is Naz Hawaii, and I'm an assistant professor at UBC School of Nursing, and I will be walking you through our research study that I just mentioned. So long-term care homes were the hardest hit sector of our healthcare system, accounting for nearly 81% of COVID-19 related mortalities nationally. This rate of mortality was double the rate of COVID-19 mortalities in other OECD countries. To slow the spread of COVID-19 in the long-term care sector, a series of pandemic management strategies were instituted across this sector. The purpose of this presentation is to systematically analyze in-depth detailed accounts of family and resident experiences and their perceptions of specific early pandemic management strategies to identify the impacts and unintended consequences of these strategies on the health and well-being of residents and family members. The study was conducted in Louis Breyer Home and Hospital, which is one of the largest publicly funded not-for-profit care homes in Vancouver, British Columbia, with nearly 400 employees who provide care and services to 215 residents, the majority of whom are known to live with some sort of cognitive impairment, like Alzheimer's disease or dementia. And so in 2018, Louis Breyer received an exemplary accreditation rating from Accreditation Canada, essentially suggesting that this care home has a very high standard of care. And so this presentation, or I guess what we're presenting here today, is one component of a larger mixed method study that included a number of sources of data collection. But for this presentation, we're going to focus on findings from semi-structured interviews that were conducted with family members and residents between October to December 2020. And so we had about 11 family members and 10 residents who participated in this study. And so family and resident data were analyzed using interpretive description analysis, which is an ideal approach, particularly for health research seeking practical solutions. And that is why we actually selected this method of data analysis for analyzing our resident and family interview data. So patient partner engagement was a really huge focus of our project, and this was enabled due to the funding support that we received as part of this study from the BC Support Unit. And so how we went about incorporating principles of patient-oriented research in our study was that before the start of the study, we actually put together a steering committee of about 10 to 15 key stakeholders, including executive leadership team of Louis Breyer Home and Hospital, their direct care providers, nurses, allied health, as well as their support workers like housekeeping. In addition to those key stakeholder groups, we also included 2 resident and family representatives who met at least once a month and provided consultations to the research team on all aspects of the project, from refining research questions to informing and conducting the study methods like data collection, reviewing the interview questions, providing input on those questions, and so on and so forth. The steering committee members, including our 2 resident and family partners, they were also involved in helping us interpret the study results, as well as even developing evidence-based recommendations in collaboration with the research team. So a bit of information about our resident and family interviewees and their characteristics, particularly their demographics. So most of our resident participants were female, over 65 years old, and had a relatively diverse range of length of stay at Louis Braille, ranging from 1.5 to 20 years. Among our 11 family participants, also a majority were female, and their relative was in Louis Braille for 2 to 14 years, and 1 family member was a sibling to 1 Louis Braille resident, and all other family member participants were either children or spouses of Louis Braille residents. Families and residents were asked to, in terms of our interview questions, they were asked to describe changes in Louis Braille since the start of COVID-19, changes in care delivery since the start of COVID-19, and the impact of these changes on themselves and their loved ones, whether they were, a Louis Braille resident or a family member. Interviewees were also asked to describe the impact of these changes on other Louis Braille residents and family members based on their experience and some of the things that they had observed in their interactions with other family members and residents. So this is an overview of all the pandemic management strategies that were implemented in long-term care homes to slow the spread of COVID-19. I'm not going to spend a lot of time on these pandemic management strategies, but just to quickly mention that these included things like, the COVID screening that was done at the front entry, the visitation, the strict visitation policy, the increasing the staffing capacity to deal with increasing demands of the pandemic, the sick leave policy, source control and physical distancing, the high risk or the single site employment order, prohibiting staff from multi-site employment, increasing infection prevention and control practices, policies for suspected or confirmed COVID cases, psychological support for residents and staff, monitoring of supplies, and finally, communication and leadership are some examples of the main pandemic management strategies that were implemented in the long-term care sector. So according to the perceptions and experiences of residents and family members, the most impactful pandemic management strategies on resident and family members' health and well-being were the visitation policy and the infection prevention and control policy. And so for the rest of this presentation, I'm going to spend a bit of time going over the results of our study in relation to these 2 specific policies. So the visitation policy was perceived to have a significant negative impact on both residents and family members. The policy was identified as causing emotional and physical stress for families who could not go in to see their loved ones or could not provide care or advocate on behalf of their loved ones or the residents in Louis Braille. The policy was also stressful for residents who, as a result of this policy, experience significant level of isolation and loneliness. And we're going to spend a bit more time on that in a later slide. Families in particular expressed significant challenges in relation to communication and advocacy. Prior to the pandemic, families, would go to the care home to see their loved ones, and just right there, they could obtain the required information or updates that they needed in relation to their loved ones at the care home. But after the pandemic, it just became really challenging to get a hold of the staff who were overworked as a result of family absence and also in increasing infection prevention and control requirements. And as a result of those two things, staff were not able to keep up with families' needs for one-on-one communication regarding their loved ones. And so these family members, again, as a result of this policy, the strict visitation policy, were not able to come into the facility and were in greater need for communication, particularly virtual communication or phone communication with sort of from the staff to get updates in relation to their loved one. And so just this quotation from this family member essentially speaks to some of these challenges that I just described. I'm just going to pause for a few seconds for you to go over this quote that essentially speaks to some of these communication challenges. So, infection prevention and control policies, or what we will be referring to as IPAC policies, were also identified as negatively impacting families and residents. As a result of increasing staff workload associated with the IPAC policy, so things like, having to don on and don off PPE, or putting newly admitted residents on isolation for a period of 2 weeks, as a result of these increasing IPAC practices, care was slowed down. And IPAC policies resulted in also canceling enrichment programs, especially the ones that were offered in group settings because of the physical distancing that was also mandated in the province. And so these changes created a sense of loneliness and isolation among residents, some of whom went as far as comparing their experiences with being in the prison. And so I'm just going to read out this quote to you from one resident at Louis Brier that said, "For me, it was really hard to be restrained to the building. In fact, when we get in lockdown and couldn't go from floor to floor even, I wasn't able to go for a walk. And it did eventually really get to me. I just really felt like a prisoner, and I was." So again, this resident essentially compares their experiences of living in the care home during the pandemic with sort of being incarcerated and in the prison, sort of speaking to that notion of isolation and loneliness that I mentioned earlier. All the pandemic management strategies that I went over in an earlier slide, particularly the visitation and the IPAC policies, interacted with one another to increase staff workload and created lots of demands, increasing demands perhaps is a better word for the staff, which resulted in resident care delays and posed safety risks to the health and well-being of the residents. Again, I'm going to read this quote from one family member, which really speaks nicely to how staff were also impacted as a result of the pandemic management strategies. So the care staff put their own personal concerns aside to be present for the residents, but they are tired. I have seen some of our best care aides shout and threaten residents because they are at the end of their rope. So essentially speaking to how the mental health of staff, long-term care staff, was essentially impacted, negatively impacted and deteriorated as a result of the pandemic and some of the stressors associated with pandemic management strategies. So at this point, we're just going to shift gears to the implications of this study. And we will be focusing on the visitation policy because, again, this policy was one of the most important policies that sort of contributed to the health and well-being of families, residents, as well as staff. So I believe the strict visitation policy was put in place to ensure the health and safety of the residents, to slow the spread of the COVID-19. But the issue is that our public health definition of health and safety is largely focused on medical safety, which sort of overlooks the importance of psychosocial elements of health that are integral to the vitality and the well-being of the care home resident population. The second implication of our study findings that families and residents experienced a significant loss of control as a result of the visitation policy and the IPAC policies. And to give their autonomy and their sense of control back, clear lines of communication needs to be developed between long-term care homes, their staff, their leadership, as well as families and residents. Families and residents need to be sort of involved in that whole process of communication in order to sort of give their autonomy and their sense of control back. And so our recommendations based on the study findings and the noted implications are that, first of all, pandemic management policies must be revisited and redesigned in collaboration with family and resident partners who have been at the forefront of many of these challenges, including the issue of overlooking psychological elements of health in some of our policies, like the visitation policy. And these voices, essentially family and resident voices, need to be present at the policy making table. That is the only way that we're going to help with giving families and the residents their sense of control and their sense of autonomy back. Our second recommendation is that additional resources need to be put in place, such as increased staffing, to essentially compensate for both lost hours from absent family members as well as increased workload during times of crisis like the COVID-19 pandemic. So these are our two recommendations that were essentially based on the findings of this study that was presented here. We do have a larger recommendation booklet, which includes a larger set of recommendations, and it's available online. But for the purpose of this presentation, we have focused on these two recommendations. So this was the end of our presentation, and if there are any questions or comments related to the study, you can reach out to me. My email address is included here, farnaz.hawaii@ubc.ca, and I'd be happy to answer any questions or comments that you guys might have. Thank you for the opportunity to share the findings of our study.